Many thanks, everyone, for joining today. I am Michael Diamond. I'm the Academic Director of the Integrated Marketing and Communications Department at NYU School of Professional Studies. And it's absolutely my delight to kick off this panel and welcome our panelists. As many of you know, the School of Professional Studies offers programs, graduate programs in marketing and PR, but we also offer a number of certificate and what we call non-credit programs, shorter courses, stackable and snackable credentials, so to speak. And we're quite excited that in the fall, we'll be launching a certificate in healthcare marketing and communications. So, hopefully the content of today's panel is the sort of thing that you'd find interesting, and many of you have indicated you would be interested in pursuing a certificate or more education in the space. Anyway, without further ado, we will have about an hour of time with our distinguished panelists, and then we're going to switch for the last half an hour for anybody who wants to stay on and ask any specific questions about the certificate. And I and my colleagues involved in the certificate will stay on. So we have with us today, starting from left to right, Destry Sulkes, who is currently the EVP of Growth at Klick Health, and also, I'm happy to say, a member of NYU's faculty. We have Howard Courtemanche, who's the Global Healthcare Practice Lead for VMLY&R, and a good friend. Marc Iskowitz, who is the Executive Editor now for MM&M, which is one of the leading, if not the leading, industry publication in the field of healthcare marketing and communications. And finally, Margie, a good colleague of mine, someone who I've worked very closely with on developing this certificate, and herself a distinguished marketer from Pfizer, who now has her own strategic consulting firm and a member of our faculty. So without further ado, I think we'll just jump in, and we can probably take this screen down, Julie, and then we'll just go into conversation. I thought what I would ask you, perhaps, I'm actually quite new to the field of healthcare marketing and communications, and as I have sort of delved in, I realized that it's quite a fascinating field, but one which people seem to arrive at in lots of different contiguous ways. So I wanted to ask you if you might share a little bit. We'll start with Margie, since you're upper left on my screen. If you could speak a little bit about how you got into this industry, what your trajectory was into healthcare marketing, and then I'll pass it over to Marc, and we'll go to Howard and then Destry. So.
Sure. Hi, everyone. So my roots were actually in strategy. My first job after university was in strategic planning at a financial institution. But I quickly realized I also wanted to be on the inline marketing side of things and not in financial services. It wasn't until a business school summer internship marketing Halls sugar-free cough drops to diabetics that I recognized, that maybe healthcare marketing is my calling. And, I just found it so much more rewarding, intellectually rewarding and meaningful to work in a sector where the consumer and the physicians are just more sophisticated of an audience, and there was so much more of an unmet need. Since then, I've been fortunate enough to work in a number of OTC medicines, a number of prescription medicines in different therapeutic areas, medical devices, and even medical cannabis. So that's kind of my trajectory.
Fantastic. So Marc, you have a different path and in a very different place as a distinguished journalist at this point. So how did you get to where you are in healthcare and marketing?
Sure. Happy to answer that. And thanks for having me, Michael. I really appreciate it. I don't want to get too wonky on you, but I've always had an affinity for writing and editing. And some more along the way, whether it was banging out, essays on the family typewriter in my basement, dating myself a little bit there, or, at 2 a.m. in the college computer lab, writing just became a labor of love for me. And when I was contemplating getting into the field of journalism, I did an informational interview with a beat reporter, sports reporter for the Philadelphia Inquirer, and he gave me the pro tip that trade magazines paid better than newspapers. So instead of becoming a sports reporter or trying to get a beat job, covering the Eagles or the Phillies, my first job in journalism happened to be for a B2B healthcare publisher covering what else? Pharma advertising. And I just kind of pretty much followed that formula, going from one healthcare journalism job to the next. And along the way, I covered everything from allied healthcare, which is, speech language pathology, audiology, PT and OT, all the way through to pharma, biotech, hospitals, insurers. I worked in the PR department for a a hospital in the city of Mount Sinai. I worked also on the PR side a little bit for a boutique healthcare PR firm, issues management firm, then came back to the journalism side and, again, covered, insurers, health tech. And I stayed with it because I really became fascinated with how the healthcare ecosystem is changing. And change is certainly the constant these days. So there's no shortage of things to write about and to learn about.
Yeah, undoubtedly. And I think your career alone sort of describes some of the breadth of healthcare and what's happening in the industry. Destry, you're perhaps the only official medic among us. So maybe you could speak to your experience and how you got into the more of the sort of marketing and business side of the profession.
Great, thank you, Michael. Great to be here, and welcome everyone. Yeah, I went to medical school, but I'm no longer practicing medicine. I actually got my MD and MBA together in a joint degree program. So I really had my eyes open to both sides of both what happens medically, but also how you turn that into a business. And I just found myself really gravitating towards not practicing one-by-one medicine, but by practicing more at scale. So working on new devices and new products that could really help entire populations. So after medical school, I never practiced, went straight to an ophthalmology device company and helped them launch a product where I started to get familiar with all the elements that go into marketing. And over the years, actually even started a digital education company called MedSite that was eventually acquired by WebMD and Medscape. So I got to see how the channels were changing, as Marc talks about, and how the technologies were changing as well. And so it kind of brings me up to my current role, where it's really being a commercialization partner to all the different clients out there, because they need marketing services, they need PR, they need media, they need market access, they need medical science. And to pull all those things together really kind of energizes me and takes a little bit of all my different skill sets. So great, glad to be here.
Fantastic. Well, I do love, my brother-in-law was a writer for ER for many years, and he said that, on every episode he learned something new about a new disease or a new problem. So so it's good to know we have a medic on the team. So fabulous. And Howard, maybe you could, I imagine you didn't start out in healthcare, but would love to learn more about your career.
No, I was, and first of all, thank you for having me, Michael and Margie. And I used to work with Destry, so leave it to Destry to look like the Wizard of Oz. I have a living room, and he has this unbelievable background. So once again, he's stealing the show. Yeah, I started out in advertising a little over 30 years ago. Right out of college, I was an English major, and I got into packaged goods, which was the traditional thing to do back then. I did cereal, I did yogurt, I did other stuff. Then I got into toothpaste, so I was getting warm. And then I got into allergy medicine and cold medicine, if you're at a Sudafed and Benadryl. And we were doing TV commercials and print ads and all sorts of stuff. And it was fun and great clients along the way. And then all of a sudden, in about 1998, 99, a little thing happened. The FDA said prescription drugs could advertise on television. So my boss at the time asked if anybody wants to go pitch a little drug called Lipitor. And I raised my hand. And so speaking of ER, about 9 months later, the commercial premiered on ER, and it took off like a rocket ship, and Lipitor became the most widely prescribed drug in the history of the human race. I think Humira has passed it. So the last 20 years or so has been an incredible journey, because at the end of the day, I think Margie hit on this. I like to tell people you're doing well and doing good. Healthcare marketing is incredibly satisfying. When you can sit and listen to people that have taken a drug that you've helped them get to, and they say how it's altered their life, or they're a caregiver, it's altered their spouse's life. It's incredibly powerful and rewarding. And I never thought when I got a job on Madison Avenue, I'd feel that way about my job. And I like it more and more. And just to finish up here, this year, now more than ever, it's been a powerful experience to be in healthcare, because healthcare has become the world's most important business. It used to be that, economically, now it's become everything. And I'm sure we'll talk about that. So it's just a great time to get into healthcare, and incredibly rewarding. And there's so much opportunity, and it's great to be here. And cheers.
Well, thank you. I'll stay with you, Howard, if it's okay. And I'd love to transition a little bit. We'll move the conversation around, but let's just stay, since you create a wonderful space, sort of doing well and doing good. I think many people on this, call, and people I've spoken to ahead have a similar motivation. They say, look, maybe I don't want to market, consumer products anymore, or I'm interested in doing something different with my life. But there's also a concern that, the field has very unique kind of needs. And I wonder if you could start to talk a little bit about what you see some of those unique needs are, and maybe a moment even where you suddenly had an aha moment. This is not traditional advertising. This is something different. Interested in that.
I tell people anybody can learn healthcare. Now, I can't say everybody can be an MD like Destry, but we've been, because of the need for people, we've been taking people from technology backgrounds at the agency, from consumer backgrounds, from e-commerce, and we've been teaching them the basics of health, so they can, and that they can be conversant in it. And a real key, and it's been frankly a key to my success, is the ability to take science and make it English and break it down. And also, that doesn't just go for consumers and patients, it goes for doctors as well, is to take a complex drug and make it into both visually and verbally a simple proposition that stands out from competition, that stands out from anything that's come before. So I wouldn't, if I were somebody out there in Zoom land thinking about a career in healthcare as just getting their feet wet, don't be scared at all about it, because it's not as hard as you think. And there's a lot of people there that really love teaching and love to take you by the hand and go, see what you can do, and see all the great things you can do.
Margie, you want to?
Yeah, I just want to echo what Howard was saying, because I think the key is, don't be intimidated by the complexity in data. I was a history major, so I always liked the sciences, but it's more about the communication, and it can be learned. Pharma companies have been taking recent college graduates and training them to be representatives for 50 years. So, and none of them really had, a biology background or chemistry background. So it's about, embracing the complexity, but knowing that it can be learned, and, learning how to read a clinical trial, because it's important so that you know how to develop the messaging, but then also at the end of the day, make it compelling, emotionally compelling, right? So that's not rational. So I think it's important to do, to kind of recognize that and not be intimidated by that. I think the other thing is, I think more and more I see this, and there are a lot of healthcare startups, and then a lot of organizations are flattening, and they expect marketers and PR professionals not to just be able to execute, but to think critically and strategically. And so, it is a more complex category, but it also requires more strategic thinking. So I think, that's kind of what drew me to kind of more pharma at one point, was that, I didn't want to do bubblegum after a while. And this was something that, kind of challenged you, but it made you think a little bit more strategically.
Marc, I'm intrigued, maybe, is there a sort of a brand or a campaign where you look at hundreds, obviously, with your awards and various things you cover, where you really have, said yourself, that really demonstrates that this is a different beast, that this is something that needs very unique sort of handling, or a medical issue perhaps, or something.
Sure, yeah. And, I'll just say that I went to, a science-oriented college, and my degree is actually in environmental communications, not journalism per se, which was kind of a stretch. But I didn't get past biology 101. I have my curiosity has taken me to where I am. But my response here, and I'll also talk about some of the practical examples I've seen, but is to say that not letting the hype outpace the science is kind of a good thing to keep in mind. As a healthcare PR pro or marketer, you have to stay in lockstep with the science and the medicine. That applies whether you're working on a brief for a pre-approval product and just setting the tone, design, language, and color scheme of the brand, or the launch when the product is approved and you're free to promote features and benefits. I saw this firsthand when I briefly worked for the PR firm, as I mentioned, and I was working on a colon cancer screening campaign. Academic policy statements were built on sound science, and that in turn led to the PR talking points upon which we built our brand's communications and issues. We had those talking points in hand, and we rarely strayed. So if you don't do this, you run into trouble, and running into trouble in this industry has unique implications, like earning your company an FDA warning letter, an FTC fine, or worse, having your product pulled entirely. And we've seen this, for instance, as you know, I'll just follow on Margie's comments about medical cannabis, which has been a bit of a flashpoint for enforcement. There just isn't enough research that's been done to support some of the claims being made by cannabis companies about the medical benefits of cannabis. The other one is, the other thing to keep in mind is you need to be aware that the price of medicines and devices and tests is the new reality for biopharma. And so to be comfortable with integrating economic information into your communications, depending on what audience you're speaking to in your communications or marketing. If it's a patient, that could just be access information or a copay card. If it's a hospital formulary decision maker, like someone who decides whether the hospital should pick up drug A or drug B for its patients, it could involve sophisticated health economics and outcomes research. So we're starting to see that more in marketing campaigns these days.
Yeah, Destry, maybe I pick up on a couple of themes that Marc raised, the uniqueness around both the regulatory, the role of regulators, and also the sort of complex interweb of payers and players and things like that. I know you're working on and teaching our foundation course in that area. So what do you see as the essence of what's unique in some of this?
There's a couple of, I think, really interesting points that folks outside of healthcare don't understand so well, which is, while the FDA is overseeing what you can say about your drugs when they come to market, what claims you can make, you have the Federal Trade Commission overseeing what all the other healthcare players can talk about. So you'll see billboards on the street for Mount Sinai curing cancer, but you won't see an Opdivo drug ad claiming the same thing, because the FDA has much different kinds of controls. So there's a lot of debate going on right now between what these new providers are saying and competing almost with some of the manufacturers, and how those dynamics are evolving. Another area that I think is pretty interesting is around the fact that, Marc, you're mentioning the science always drives the messaging, right? And I think by and large, of course, that's absolutely true. And yet we're doing a bunch of research, some of this back my WPP days with Howard, on doctors being people. Doctors respond just as emotionally to advertising as does the average patient or consumer. And the best ads are the ones that really tap into that, like Margie was saying, the behavioral science aspect of asking a doctor something about how they feel about a condition or a drug or a patient, rather than just what the science is saying. Because they can read the science on their own, but it's that positioning we create and the magic we create with our creative friends that really creates that emotional bond.
Yeah, and I think it aligns very well with something we talk about generally in marketing, that marketing is essentially a human-centered and data-driven enterprise, that role of emotion and affect is always at the center of what we do, whether you're talking to doctors or patients or otherwise. Yeah. Margie, you had something you wanted to jump in?
No, I was going to say, because you always say this, that in healthcare, marketing and PR is really even more interwoven. I think the communication aspect of it, and we're seeing it right now, right? Like, how hard is it to get people to wear masks? But no one's done maybe the research to think about, how do I contextualize this and present it in a way that convinces people to change behavior? And as simple as that, I think that's kind of where healthcare is unique, in that it does kind of really come together, really tightly woven. It's not like, oh, there's execution here and then there's messaging here. It's really integrated.
Yeah, no, I'm pleased you raised that, because I think, my experience working with you, Margie, and a couple of our colleagues on a project for one of the big pharma companies really highlighted for me how integrated those things were. In other avenues and areas of marketing and PR, everyone's debating the role of the CCO and the CMO, et cetera. But it seems to me in pharma, those two are much more closely aligned. They say necessity is the mother of invention. But I want to, if we can, just to move the conversation along a little bit, is there are some. I mean, we talk about this industry, this field as a dynamic one. It's clearly a growing one. All the data suggests it would be a smart career move to pick up and think about healthcare for all sorts of reasons. But it's also a very dynamic one. It has been impacted by all sorts of interesting emerging trends. And maybe I'll hold the conversation around data and digital specifically for a little bit. But what do you think are some of the major trends that you've seen that emerging young professionals should be keeping their eye on? And so, Howard, maybe you want to jump in on that.
This goes back to, I think Destry might have seen this chart, but I've been espousing a chart that says the world is getting older, sicker, more populated, and fatter. And that's great news. Welcome to healthcare. So, simple demographics drive so much, and that's why there's so much opportunity. And you take that and you cross that with the Human Genome Project and the advances there in year 2000, 2001. And I should get this quote right, but somebody said, like, in 1950, a doctor will learn something new every 18 months. And don't quote me on this, but now I think it's like 18 days a doctor learns something new, because the industry is changing and advancing that much. And just look at what's going on with COVID. And about half of our clients have a vaccine or a treatment in the offing, or something that'll curtail a hospital stay. And that's proof in the pudding. Hopefully this will be the end of this, or a win will be pharma's finest hour right now. And I just read also, I read at MM&M today or yesterday about pharma's reputation getting a lot better now because of the news every day. So hopefully you'll come out of this and you'll say, scientific innovation won the day and helped us get out of COVID-19 and this incredible crisis. So it's just so exciting because of the pace of innovation. That's really the headline here.
I would just build on that. Like, I think, the US population, right, simultaneously growing and aging, more people will be aging in place. I think that's one thing. And then also, I think patients are seeing themselves as customers first and patients second. And a lot of that is because, thank you, Amazon, I should be treated with the same level of response. So I think you're seeing patient empowerment really take off. And then I think, just to toss this to Destry, but like the innovation from the non-traditional players, like, the Apples of the world, the wearables. I mean, that was not traditionally healthcare 10 years ago, and it is here now. So I think there's just really some exciting trends. I mean, horrific stuff that, pushed us into this, but I think all these trends are accelerating as well.
You probably noticed yesterday that Teladoc acquired Livongo for $18 billion.
Mm-hmm.
As a sign of the expectation that this space is just burgeoning.
Yeah.
Amazon Care started their own telehealth service in Seattle.
Yeah.
Which will eventually be like Amazon Web Services, which develops only for
and
Amazon.
It's like
and offered
table stakes. Yeah, table stakes now. It's not kind of an option. It's table stakes.
Yeah, and that sort of brings us to a broader conversation about digital and data. But before we go there, I wonder, Marc, are there any sort of, again, recognizing that most of the audience, myself included, might be humanities majors, but are there any important scientific sort of discoveries or areas of sort of the pharma bioceuticals that you think, young people should be thinking, like if they're interested in this space, this is one of the things you probably need to, just find out more about. What's interesting?
Sure. And just build on, Howard's point about the pace of science, with molecular medicine, gene editing, and now COVID kind of speeding up science. And, scientists are putting out research on preprint servers, before they're even appearing in peer-reviewed journals, just so that they can collaborate better. Pharma companies are collaborating more, doing things that used to be unheard of, where, R&D chiefs are getting together, and meeting in the same Zoom, conference and sharing, drug formulas that could work against the virus. And as Margie and Destry, mentioned, some of the big, M&A mergers and acquisitions in the space, are very telling, as is the entry of Amazon. But, you know, and Margie, as you mentioned, you know, the consumer empowerment, I would just kind of build on that for a second and say the consumer is really shouldering a lot more of the cost of care. That's an important thing to be aware of. And thus they've become a smarter shopper of healthcare. This in and of itself has not led to a decrease in healthcare costs as some had predicted. The system is just too opaque, and it's kind of impossible by and large to for the consumer to do an apples to apples comparison, weighing cost versus quality when deciding, you know, where they get their health care, at least not easily. You know, maybe you could do that for the cost of certain medications, like through a GoodRx or something, but less so on things like medical procedures and surgeries. We're all healthcare consumers today, and we see the national discourse on drug pricing and how America pays the highest premiums for healthcare in the world, yet we get disturbingly low quality for it. So it'll serve you well to understand these themes and to keep them in mind. We're not in a fee-for-service world anymore. We're moving more toward value-based care. That's a whole other discussion, but that's driving a lot of the macro changes you see in the healthcare system. You know, like Destry mentioned, you know, the teledoc, which is an example of what they call horizontal integration. A couple of years ago, we saw CVS buying Aetna. So that was a pharmacy chain, which also has a pharmacy benefits arm, scooping up an insurance company. And a big reason for that merger was because CVS felt that they could deliver care more inexpensively by steering Aetna's members into CVS's minute clinics. So the site of care is very important. It's cheaper to have your blood pressure checked in a walk-in clinic within a pharmacy, obviously, versus in the doctor's office. And you need to be able to help your clients understand these kinds of healthcare system changes or dynamics. And even pre-pandemic, there were many, many different kinds of healthcare service companies popping up, like a One Medical and a Babylon Health. You know, One Medical was these, you know, very futuristic clinics where you'd go in and you'd see all the latest technology, diagnostic and treatment-wise. Babylon Health offering you know, the ability to Skype with your doctor and get a drug delivered to your doorstep. And post-pandemic, we've seen the spike in telemedicine and, you know, Teladoc buying Livongo this week, you know, is another kind of horizontal integration. They didn't buy Doctor on Demand, which would be another telemedicine company. They bought a company different but related vertical, digital health. You know, Livongo uses behavioral techniques delivered digitally to improve outcomes for people with diabetes. So again, you know, people need to realize these changes that are taking place, to read up on them and be prepared to help clients, you know, make sense of them.
Destry, maybe take us a little deeper into the role of data and digital. And certainly it seems to me, you know, this, you know, CVS Aetna is probably as much about data as well, and, you know, how you leverage it, how you use it, what we learn about customers, etc. You've had the opportunity to, you know, really dig deep, I think, both on the analytics side, but probably think about it much more strategically in terms of growth. So what do you think specifically about digital and data and how that's impacting the healthcare space?
Yeah, really great question. And I see them as very different and very related. So on the digital side, I think we were talking about a lot of these interventions where you actually now have digital apps going through the FDA for approval so that you can use an app to treat your depression or to treat different emotional states you might have. On the data side, this is where we're kind of catching up with the rest of the world. So Google, Facebook, Instagram, Amazon, they've got identity graphs on all of us. You know, they know where we spend our money, where our cell phone's traveling, and they actually can triangulate what diseases we have and what we might have in the future even. And so I think what we're facing right now with this COVID-inspired leap ahead into digital and data, I think we're going to start seeing a lot more of that as well, because a lot of the old concerns have kind of gone down. Because, for example, it used to be illegal to do a Zoom call with your doctor because HIPAA was afraid the data might get out. Well, guess what? You know, there's been 100 million Zoom calls with doctors and no one's data's gotten out. So everyone's realizing those fears were a little overblown, and the benefits of doing things differently are much greater than those fears. And so the same thing I think applies really to identity graphs and helping us predict our own outcomes. I think we're going to start seeing services from some of these traditional providers where they'll ask us if we want to opt in, so they're not going to be stealing our data. But then they'll provide us little hints like, hey, if you want your parents to opt in, we'll hint when they might need to go to the doctor and get their hypertension checked up. Things that you wouldn't otherwise think of that could really make for a much better life. So it's really exciting in that sense.
I think just to build on that, for you know, professionals looking at coming into the space. I think the role of analytics and really getting comfortable with that. I mean, I always say it's a luxury and a curse that we have so much data in pharma. When you go to other countries, they don't have this data, or when you go to other segments, they don't have this data. But, you know, being comfortable with all the data and analyzing it is important, right? And learning that is probably more fundamental in the healthcare space and maybe in more packaged goods, I have to say. I think, you know, learning how to read a clinical trial, but then also learning, like, you know, where are all the scripts coming from? Are these continuing patients? Are these new patients? Are these lapsed patients? I mean, there's so much data, it's so rich, but then there's the danger of doing too much analysis. And I think the healthcare marketer and PR professional has to learn to kind of find that balance between kind of the art and the science, if you will.
Yeah, Howard, I have a sort of perhaps a related question going back to this, the sort of plethora of data and how it gets used. And you had a lovely turn of phrase about take science and make it English. I was wondering, how do you take creepy and make it cool? You know, I mean, there's a very, you know, it's a very creepy idea that people would have all this data on us and our health. And how do you think as marketers, you know, we should be thinking about that?
Yeah, I have a different take on data. It can be incredibly valuable, but it can also be incredibly suffocating. And you have to be able to mine, or have people that you work with mine the data to get those nuggets. And it's not easy to do. Destry was very good at it. And so that's one thing. And so the creepy question, creepy and cool. Yeah, I mean, data can inform very big ideas, creative ideas. And it can inspire. And but again, it goes back to, okay, there's a lot of data here that I can't do anything with, even though, you know, factually it can be valuable. But when you find that nugget, when you find that one or two things that you say a brand can elevate itself because of this data and can separate itself, it can lead to really, really powerful creative ideas. And that's the fun. That's the fun of data, is finding the needle in the haystack that'll really drive it.
Right. Yeah, and I've been thinking about this a lot, you know, in the context of COVID-19, and maybe we'll transition there a little bit, which is, you know, I think for many of us, I'd speak for myself, you know, I'm willing to give up a little bit of my privacy and my, you know, my data if it means I and my family can stay healthy and that I can contribute to a healthier community. And I think that sort of certainly has been a bit of a threshold for me, at least, you know, whereas maybe I would have been less comfortable about that. What do you think? You know, maybe jump into Marc, just in interest of rotating the conversation a bit. But what do you think are, you know, what do you see as some of the more immediate impacts on the field, especially marketing and communications from COVID-19? But also, which is an area that fascinates me, is what are the long-term impacts? Like, what a lot of us running around saying, oh, things are going to change, we're going to be, you know, more dedicated to each other and earth friendly and all sorts of things. But, you know, what do you genuinely believe might be long-lasting impacts from you know, the experience with COVID? And one has to recognize it's been devastating, clearly, you know, over 145,000, I think, as we speak here, deaths in the US, and, you know, worldwide much more significant. So, you know, but one has to ask, you know, what will we learn from it all?
Sure. It's a great question, Michael. Amidst a myriad of changes, I'll just speak to the professional marketing side, which, for those who may not be aware, is marketing to clinicians. And the immediate concern there was maintaining the flow of vital medical communications between pharma companies and doctors and other clinicians. You know, in many instances, clinicians rely on information from drug or device manufacturers you know, for the products that they prescribe. And science is always changing, as we said. So things like clinical updates, new clinical studies that have been added to a drug's label, or you know, FDA-approved indications need to get through. And these are often delivered by medical science liaisons, which are kind of highly trained, you know, liaisons that kind of come from out of the medical information departments of drug companies, or drug reps, or medical education companies, via such channels as live congresses, or through things like dinner meetings, where doctors would be treated to a meal and then hear a respected colleague deliver a paid talk about a product. All of that, of course, you know, went away with COVID-19, and the industry had to shift to 100% virtual. this was a scramble, to put it mildly, and some companies were more prepared than others to go digital, but the others had to get smarter in a very short time span. It's unusual for the drug industry to change that quickly. They've talked about digital transformation for a decade or so. And I heard one stat that, a 6-month process and learning curve was essentially reduced to a 6-week one. So some delayed launches, other companies plowed ahead and launched amidst the pandemic. Marketing budgets were slashed as companies moved from sales forces and live meetings, which are usually the priciest parts of the budget, to cheaper digital tactics. And now as public companies like marketing and ad holding companies and drug makers release their earnings from Q2, we're seeing the financial effects of fewer doctor visits and decreased prescribing. So healthcare was a bright spot, for some of the ad agencies. Going forward, I think we'll see a hybrid approach in professional marketing where drug reps will still be around, but they'll be better trained to deliver digital presentations, as well as the occasional live visit. All of this is good for doctors because they'll be able to get the medical information and education that they need in the form that's most convenient for them. Obviously, telemedicine was probably the biggest change in healthcare delivery. President Trump just signed an executive order this week to make that a permanent part of the landscape. And we saw healthcare insurance companies easing reimbursement for that and state licensure easing up. So it wasn't as much a concern for doctors to practice telemedicine across state lines. And just overall, a heavier reliance on digital overall will be a lasting effect of this.
Fantastic. Anyone want to jump in? Any sort of more specific thoughts about COVID and coronavirus and our role, perhaps some judgment on our role as communicators during this? Have we done a good job? Could we have done better?
No, I can say, to the point, Mark's point is that our business is up, and healthcare is a big driver of it, and technology is another big sector that's up, and obviously, comfort food is up too. But COVID's changed the world forever. And I don't know, Michael, if, we're going to be on the train 5 days a week ever again. And what we've learned in the advertising business, I'd love to hear what Destry in the communications business, what we've learned is the time you get back to be able to create versus the time you used to be commuting and getting into New York and getting around. And now I've had creative people tell me, because we've done a lot of pitching and a lot of quick thinking, they've told me that 7:30 to 9:30 time that I used to be on a train or in a bus or something is incredibly valuable. And I can come to the table not beginning to think, but having thought through things. And so that is a big, big, big difference. And to use the term Madison Avenue, if anybody uses that anymore, Madison Avenue will never be the same, I believe, after this.
It'll be virtual.
Also, yeah, it's virtual. And the fact that I have 10-minute meetings now, as opposed to, and they're productive 10-minute meetings. Things get decided, as opposed to, okay, we have a meeting with Howard and it's a half an hour or 45 minutes and people straggle in late and then people go out to go to the, and we have a 10-minute meeting. Here's the topic and what's the decision to be made. We talk it out, we make the decision, we move on. And it's just a different way of working. It's much tighter and much more productive. And I think, I'd love to hear what others think, but I just think that the world will never be the same. And I think in a good way.
Destry, you want to comment a little bit from comms, and then guys, I'll ask Destry to comment, and then we'll talk a little bit about skills, the skills that students require. And I'll just take this juncture to remind anybody on the call, if you would like to ask a question of the panelists, in the bottom of your screen, you should see sort of 2 bubbles. It will say QA or Q&A. If you type in your questions there, then I'll be monitoring questions and I can field them to the panelists. But I encourage you to start thinking about that, and we'll hopefully covered a lot of your questions already, but we'll come to those specifically. So Destry, some thoughts perhaps to round us out on COVID, and then Margie, maybe we'll pick up the conversation with you and skills, and what skills specifically. So.
Sure. Yeah, there's been a real silver lining, Howard. I would agree, in the sense that we have a lot more productivity. There is Zoom burnout. Don't want to deny that. So sometimes now we take phone calls and you just walk around the city while you're on a call still being productive. So it's been really lucky that way. And smart Michael Diamond is actually starting this new certificate in the healthcare field, which is still growing during the pandemic. So we all are very blessed because within the larger holding companies, we know there are industries that certainly are not growing right now. And so we're in a really sweet spot, very lucky.
Well, I think it was Churchill who says, no good crisis should go unwasted or something like that. But,
Never waste a crisis.
Never waste a go. But, I think for NYU, especially, I have the blessing of leading and supporting, I think it's 250 faculty in marketing and communications, the broader idea of healthcare and serving that space, I think both for the reasons that you all mentioned at the beginning, as doing something well and doing something good, as well as the fact that I think it genuinely is a very fascinating business to be in, and notwithstanding the obvious fact that it's growing and critical. So we're excited about the new certificate. Let's talk, actually, it's probably a good segue actually into what are the kind of skills, critical skills that you think young emerging professionals need to work on, and recognize some of them may be not unique to healthcare, but wherever you want to take that, and we'll probably just go around the bases on that one, and then I will, as you're doing that. So Margie, if you want to hand off to whomever, and then hand off, and I'll check for Q&As, and we'll pick up the conversation.
Yeah, I think, one area, just almost to tie back to the last question, like, I think there is still an opportunity for folks in this industry to up our health communications game, if you will. I don't think we're there yet. I mean, even when there is a vaccine, we're going to have to figure out how to message this to the anti-vaxxers and get them on board. So that, I think, it becomes even more important, right? How you balance the rational and the emotional. I think the other thing, if I'm hearing your question correctly about, for specific to this industry, I think one of the things that, everyone has learned, when they work in marketing, is that consumer purchase journey. And I think in healthcare, we have something similar called patient journey, and really understanding what a patient's journey looks like from the minute they have symptoms all the way through to diagnosis, presentation, treatment, and, follow-up. I think not only understanding what that looks like, but how to build it in a more quantitative, analytical way. I mean, because the data is there, but to Howard's point, like, balancing that, right? But how do you kind of, pull out insights from that? So I think that's a big skill set that is very unique to this category, and probably something like I think about when I started out. I wish someone had taught me that. At business school, you didn't really touch on some of these things. I think you learn some of these things when you're on the job, but I think if there's an opportunity to learn these things, ahead of time to help yourself kind of get into that space, if you're not already in that space, would really, help you differentiate yourself.
So I may hand off to, I hand off to, let's jump into Destry then. So, we've pushed you to think about this very specifically. As I mentioned, Destry and Margie are two of the course developers for our new certificate. So we've been putting them through their pedagogical paces, so to speak, to think about what skills are really going to be required. So, if someone stopped you in the street, perhaps I'll ask the question which gets asked of me from time to time, which is, I wish they would teach X at the university. Like, why don't you guys teach the following at the university? So what are the sort of things, Destry, you see, at least when you work with emerging young professionals coming out of grad programs or coming out of undergraduate marketing programs, you say, gosh, I wish they knew the following?
Sure. Yeah, we have been thinking about it a lot. And I think it starts before the skill set, even with a trait. And the trait is insatiable curiosity. And I say that because there's a lot to learn about healthcare that folks really don't understand in their day-by-day life unless you're in the industry. They're kind of like secrets, I'd almost say they are, in terms of how money gets collected from health insurance companies, either directly from people on the street or usually from employers, and then how that money makes its way through the system, either to a doctor or to a drug company or to a hospital, and all the rebating and contracting that goes on with the pharmacies that are in the middle and the specialty benefit managers that help really make sure that the right monies go to the right places. That's what I'm actually going to teach, because I believe that my understanding of that took me quite a while to get to, even as a doctor. But once I had a grasp on that, then I understood where communications could really have the most influence.
Yeah, I'll jump in. I loved the insatiable curiosity. And I just wrote down a few things here, so I'll rattle it off. You know, never be satisfied. You gotta have a ton of energy, passion. You know, you gotta be in the details, but also have the ability to think, to move up and think up here. You have to have multiple disciplinary skills. You need to simplify strategically, the ability to do that, very important. Also, don't get frustrated. You know, don't get, because you're going to have a lot of blind alleys and a lot of people will be telling you no, and it's that curiosity and the ability to never be satisfied, to push on, and with that, hand in hand, is a sense of humor. And then at the end of the day, I think the biggest skill is you have to have the ability and the drive and the want to love people and to love to help people, because that's the greatest satisfaction that I get, and I like to, you know, convey to my colleagues, is at the end of the day, we're doing good stuff. And we make lives better, makes lives longer, make lives healthier, and not many people can say that in their jobs. And I think that's one of the most powerful, you know, recruiting tools for healthcare, is the ability to say that. And you know, those out there in Zoom land, come on in. We need your help.
Fantastic. Yeah, I'm reminded of a wonderful comment by Cornel West that I often quote. You know, the Princeton philosopher and theologian, and he talks about this idea that you need to love the people to lead the people, and you need to serve the people to save the people. And I think that's very much, you know, a lot of what we teach in leadership is around servant leadership, and in marketing is around really honestly loving and understanding, you know, in order to be much more attuned to, you know, your movements as a leader, but also your movements as a marketer. And the idea that you are literally saving people in healthcare marketing and communications, I think is very powerful. Sorry, Marc, we'll give you the final word perhaps on this topic, and then we'll navigate to some questions from the field, some of which, you know, are topics we've covered. But okay, Marc, thoughts about skills? I mean, can I ask you perhaps, Marc, from a leadership perspective? Yeah. So I think, you know, I probably, everything Margie, Howard, and Destry said would apply at all levels, but you know, you get an opportunity to observe leaders of these firms or CMOs or whatever, and perhaps seen careers actually shape, you know, over the last decade or so. Any thoughts about what you think really sort of stands out? You know, what leadership qualities that the people who've been successful bring?
Sure. I'll answer that in two ways. I think, you know, there's been a change in the types of leaders we're seeing and in the necessary qualities. You know, the leader today is more likely to be a woman. You know, we see that in our annual career and salary survey, you know, that we do, that's out in the field now, as a matter of fact. And beyond that, there's been a sea change, you know, in the necessary qualities. Leaders, I think today are feeling more comfortable with asserting themselves from an ethical point of view. You know, we've seen some pharma CEOs, you know, take principled stands over the last couple of years that were highly unusual, like Ken Frazier, you know, at Merck, quitting, you know, President Trump's Manufacturers Council a couple of years ago, you know, after the Charlottesville incident. And I think leaders today also have to be very acutely aware of and prioritize diversity and inclusion really as a pillar of their hiring and promotion. You know, I think for too long, the assumption was, well, there aren't enough qualified people for these positions, and that really is not the right approach. You know, we now understand that it's all our responsibility to mobilize and especially those making the hiring and promoting decisions to leverage that privilege and power to the extent a leader can, to go into schools, attract young people to the field, to participate in panels like this, you know, and I commend NYU for convening this panel and for the certificate program that you're starting, but to promote people from the Black, Latino, and LGBTQ communities. You know, and this is especially important in healthcare, because if we don't have a healthcare marketing team that reflects the diverse tapestry of America, then there's going to be, you know, unfortunately, we're going to be promoting poor outcomes amongst those communities, because our communications and marketing won't be effective in stimulating demand in those communities, because we won't be taking the right approach. And that will perpetuate, unfortunately, the poor outcomes that we've seen for far too long and the mortality that we've seen for far too long. And not only do leaders need to attract those kinds of people into their ranks, they need to foster and cultivate that talent, you know, because young people who are from the Black and brown communities, you know, they oftentimes don't see themselves in the roles that they aspire to. So it's important to have, agency-sponsored groups, corporate-sponsored groups, so people can be there, bring their true selves to work. And just to follow on what Destry said about, the things that are not taught in school, drug pricing, market access, and health economics, I think those are skills that are not taught in a formal way, but that really should be, taught in some way, shape, or form. And also, user experience, as Margie put it, there's an expectation amongst consumers for that Amazon experience. And there's kind of a collective realization that the user experience in healthcare, whether it's an insurance company, a pharma company, whatever it is not where it needs to be. And so if you're a young person, I would encourage you to get the skills in improving the user experience. And I think that would be very much in demand today.
So it's a great segue. We had a couple of questions. Thank you very, very much for that very, very thoughtful and broad answer to the question. We had a couple of questions about basically how do I get started? So we have some willing buyers out there, people that are very keen to jump in. One question more around, what sort of job titles should I be looking for? I presume if I was scanning ads or LinkedIn, so what's an entry level type position? And the second is a little bit more about, what's the best place and best way to get more educated about this? So any thoughts to that topic?
So assistant account supervisors would be on the account side, and client service titles, project management titles.
Yep. Yeah, creative is a harder get because you got to have a book, and that's more specialized. But what Destry just said is right on the money. This is for agency work, of which there's plenty of openings for junior people, and they all change, daily. And if you follow, I would follow, and I've been giving this advice for years, follow the advertising trade press and online and find out, okay, such and such agency picked up this account. Chances are they're going to need people at the junior level because they don't have people sitting around doing nothing. And I know a lot of people that got their start just by following the trade press and sending an email and getting and they get an interview. So it's not as hard as you think. And just being, what I call politely aggressive. Don't take no for an answer, and you find somebody that gets back to you. Just the entry level is all about risk because you don't have any experience. What you want to do in all of your conversations is make that risk gap nothing. So you're like, oh, I have to hire this person. They really want it. They're hungry, and there's no really risk. And let's go. So others.
Yeah, Margie, you have a nice formulation around doing and being and.
Oh yeah, my be, do, get philosophy. So the philosophy, and this is a wise person coached me on this. Like, be the person that you want to be. Think that way, then start doing, acting, and then you get your titles. So I always tell that to folks that want to get promoted too early. Be, do, get. But I think part of it starts with embracing kind of even things like taking. Outside of even the certificate course that we're talking about, like there are classes out there that you can take online right now. Go to Coursera, take a class on something that even sounds remotely in the therapeutic area that you're interested in. Get comfortable with the lingo, get comfortable with the jargon, and just read, like what Howard was saying. Like, you can learn so much just by reading some of these articles and understanding. But at the end of the day, we are all patients. Let's put it that way. We are all patients. We've all gone through a patient journey. And if not, in the immediate, near term, but someone that went through that. So it is not as foreign as you think. And actually, it's a lot easier to narrow that gap, like Howard was saying. I think, starting to take on projects. If you're at an agency already, maybe you're not in healthcare, but, go to the account person and say, hey, can I do something for you? Can I work on something, on the side and start learning? I mean, I think that's kind of what folks are looking for, that hunger that you want to learn. Like, I always say this, you cannot teach passion. Either you have it or you don't. So I can teach you how to detail a physician. I can teach you all about therapeutic area, but I can't teach passion. So I think, to Howard's point, when we see passion, that's like, okay, you're hard.
Yeah, no, that's fabulous. All right, well, we have a couple of minutes more. We have one or two specific questions. I'm going to follow up directly with some students working on capstone theses. Very interesting. Sounds like around the role of communications to support better health outcomes. But I think we'll perhaps take that offline, Angelique, and I'll put you in contact with some good folks. And then, you know, more on the same theme, actually from one of our students who graduated a year ago. If I remember correctly, she won a wonderful case study prize. Actually from Pfizer, I think it was, but they were one of the participants. But she asked around. She said, "I graduated last year, and I'm doing, you know, marketing work at a small tech startup, but I'm very interested in getting into healthcare. So, kind of, what's the typical path?" I think Destry, you started to talk about some of those titles, but you know, what do you think? I mean, what do you think is what does a typical path look like? Let's take it from the agency perspective, Howard. Like, you know, if someone was starting out with an agency, where do they start, and how do they move around?
I mean, if you knock on our door and if you have an NYU degree, and just a little commercial for NYU, I'm a big fan. My daughter's a class of 2020, and she's working at Deloitte, so NYU helped her get that job. She wouldn't have gotten the job without the NYU juice. So love NYU. But yeah, if you're out of NYU, you have a technology startup background, and you're interested in healthcare, I mean, just apply. I mean, and have that conversation, and you know, and communications is kind of a culmination of all these things. You know, both either to doctors or to patients, and more we're doing it all. So it's just that, you know, Margie said some great stuff.
Yeah.
The passion. It's about passion. If you really want to go in there, just say,
yeah,
I want to learn healthcare. I'm really excited, and I have this going for me, NYU and technology, and I mean, you'll get an interview. NYU and in the fact you have a current job will get you in the door. You'll get a conversation or whatever.
And I think the fact that you're in tech, whoever the student is, it's so transferable. I mean, to the point that Destry was making, like, it is about tech. There is no more boundary anymore. That boundary's blurring between the Apples and the Qualcomms of the world. They are a healthcare company. So I think you actually have more leverage than you think. If you're working if you think a purely tech company, those people are looking for folks like that. So I think it's a lot of transferable skills, whether or not you know it or not.
I would layer on a little bit of research.
Yeah.
Yep.
You walk in with passion and an NYU
Yes.
degree, you're going to get talked to. But if you did just a little bit of research into your
Yeah.
And how it relates, how what you're doing relates.
Yeah.
And the other thing is talk to people. And again, the more you know, to Destry's point about research, the more you communicate with people about that have jobs in the healthcare space, the more you know, and the more you realize what you want to do and what you don't want to do. And you just specify. So when you're applying for a job, you're not just saying, I want to get into healthcare. I want to get into healthcare, communicating to patients. I want to use my technology background, and I can start tomorrow, you know.
Yeah.
But yep.
And it's sound advice to use informational interviewing to think about what you don't want to do. Yes, I mean, you know, it's a fine line these days. Jobs aren't falling, you know, out of the trees, but you know, I think you can also, you know, figure out some places that won't make you happy or you're less interested. So, all right, guys, we're at the formal end of the first part, and I want to thank all of you. Really, a great conversation, very engaging. If you can stay on, wonderful. If not, Margie, Quo, and perhaps Destry and I certainly will be on. We want to talk about the certificate. So, you know, without any, you know, too much, you know, internal advertising, we do think that this certificate of healthcare marketing and communication is a great place to start for people who are interested in learning more. So encourage those who want to stay on to stay on. But many thanks to our panelists, and delighted to have you attend. We will actually send around a recording of this to anybody who registered, and clearly anyone who registered attended as well. So if you weren't able to take notes, copious notes, we will have the talk come back out to you. So, all right. Let's transition a little bit. I think between Margie and I, and anyone obviously on the call is welcome to comment too. We wanted to talk through a little bit. I still am going to encourage you to use Q&A. I'm sorry, it would be ideal if people could talk, but if you don't mind staying with the Q&A, I'll try and be attentive to the questions. NYU, let me do a quick intro. Most of you hopefully know about NYU, very illustrious brand and educational institution in the city. more and more of our offerings have gone online, both as a response, to where the market has gone clearly, but also, as you can imagine, in order to accommodate our students' academic progress, with COVID. We have within NYU a school called the School of Professional Studies, celebrated its 85th anniversary a year ago. And it's a very unique school in that it's always been dedicated to this idea of access and opportunity, and really providing people opportunities to pivot in their career and develop personally and professionally. Little known fact, it educated a very significant number of GIs, came back from the war, was actually even part of, I think, the FDR effort, during the Great Depression. So it's a school that's been dedicated to really helping individuals kind of find new paths generally. In the last 10, 15 years or so, it's become very sophisticated with respect to, graduate degrees and formal professional education. And as I mentioned at the opening, for those who were able to join, I run a master's in marketing and a master's in PR program, but we also run a number of what we would call certificate or non-credit courses. And that allows us to have a broader range of professional qualifications which have meaning in the marketplace, and provide you sort of that leg up or that perspective into an industry you're interested in exploring or learning more. We launched this fall, and we're very excited to do so, a certificate in healthcare marketing and communications. And as most, if not all of you, just heard on the preceding call, it's a field that we think is an important one. Hey, Julie, if you want to advance the slide there. I will sort of give you a little bit of a sense of the industry, and then Margie, perhaps I'll ask you to talk about the course, and Destry too, some where we're trying to go with the course, and we have a slide outlining the various course requirements, and then we'll finish with some basic information of where to find out more. I believe my colleague Kate Entz is on the line and can answer some detailed questions if need be, or we can take down details and get back to you. But this slide is somewhat of a sort of a capture or a summary of hopefully the things you took away from the previous hour. The healthcare sector is clearly growing rapidly, which is a great thing for emerging professionals who want to start a new career, or folks already perhaps a bit more established in their career, but concerned about where different sectors are going. Some sectors are drying up, and others will thrive. So it's a very important sector from an employment perspective. It's also a very dynamic environment, which I think for many of us, who are interested in a challenge, a marketing challenge or a technology challenge or a PR challenge, etc., you want to find environments that are changing, and so it's an important space with that respect. Largest driver of job growth in the US, if you look at the Bureau of Labor Statistics, or this stat here from Glassdoor, which projects about 1 million openings in healthcare and biotech. Not all of those, obviously, in marketing. Many of them are on the front line specifically, but a growing field. Unique and challenging. We heard some of those themes around regulations and the sort of complex web of different players. What I find fascinating, and I'm a student of business and a professor here, is the idea that these business models that had been quite well established for a long time, or more broadly, what we would call in marketing the consumer value propositions, so that what are those things we put in front of consumers? Those have been radically changing, driven by digital things. The quantified self, for example, is a term that's used. So all of us now are comfortable wearing devices on our wrists, weighing ourselves, measuring ourselves, tracking our running, checking our heartbeat, checking up on each other, etc. So that all of that data being produced and its capacity to advance our health is significant, alongside all the digital technology that supports it. So that's a very important field. And then I think I would say, and this is something I've learned myself over the last couple of years, being somewhat more involved in marketing. My background was more out of media, entertainment, and telecommunications. I was acting CMO at Time Warner Cable and worked at Time Warner for almost 20 years. So my background is much more was outside healthcare marketing and communications, but you know, I think these fundamental skills in brand building or consumer engagement or, you know, communications more generally, they're very important, they're foundational, they're fundamental to healthcare marketing, but they clearly need some customization. And, you know, the goal of this degree, this certificate, sorry, this qualification is to help you with that level of customization in your education. So if you already have some marketing experience or even a decent amount of marketing experience, what are the ways that I need to translate and transfer that? Or what are the things I need to know about the industry more generally? Let's transition to the next slide, and I'll give Margie perhaps an opportunity to speak to some of the you know, overall outcomes, you know, that we're looking for. You know, these are the things which we hope you as students will leave the program having learned, and then we can talk about some of the courses as well. So
yeah, thanks, Michael. I think, you know, this certificate is really to help any marketing communication professional launch, switch, or advance their careers in the healthcare sector, and help you differentiate yourself, right, from maybe more of the, you know, packaged goods marketer or communication person. The way that this certificate was structured was really trying to teach the fundamentals so that you get really up to speed quickly on the lingo and the terminology in the healthcare space. You know, half the time it's about understanding the terminology and being able to talk to prospective employers about, you know, showing and demonstrating that you understand how to navigate this changing dynamic ecosystem, and you've mastered some of the fundamentals that are needed. And, you know, for those of you that were heard early on, you know, things like understanding not only a consumer journey, but a patient journey, things like that. So the way that our certificate was structured is built around two foundational classes. The first one is the one that Destry is teaching, is really, you know, what is the ecosystem look like for healthcare? You know, understanding all those interrelated roles of all the different stakeholders. And we mean more than just the patient and physician, you know, a lot more patient advocates, insurers, hospitals, you know, agencies.
Margie, just a quick thing. We're going to cover the details of the courses.
Oh, okay.
Yeah, no, I just wonder perhaps we could talk a little bit about some of the outcomes that are you know, listed here. I mean, you know, this is our feeling, and I'm happy to take the slide and you can speak to the next one if you want on the course specifics. Let's do it that way. You know, I think I want to pick up on what Margie was saying, because you know, Margie herself is quite unique as a marketer, and probably I owe her 100% of my education in the field. So you know, I appreciate that. You know, I think, you know, the key thing as you're entering this space is that you need to emerge from your learning and understanding with these 5 broad capabilities. Yes, we believe that they'll set you up. So one is, and you know, all of the speakers spoke about this, which is to evaluate the interrelated roles. Yeah, so there's so much complexity in who pays who, and who provides who, and who develops what, and who approves what, etc. That stuff you really got to learn. Yeah, that's foundational. And Margie will talk about the courses specifically. The second is really understanding that path. Consumer journey is one, but here we're talking much more about almost like a product life cycle. Yeah, so you need to, at the end of this course, you're going to be able to explain to anyone, you know, how medicines, devices, services, etc., how do those things get developed? How do they get tested? How do they get approved? How do they get launched, etc.? You'll know precisely the sort of path that those things take, and that makes you more, you know, valuable and more confident as a marketer, obviously, in the space. The third is that, you know, there are all sorts of very unique challenges and opportunities, and we're always half glass full in marketing. Yes, the challenges are also the opportunities, where you can use marketing and communications very specifically to advance the needs of the field. And I think one of the things this certificate, I think, will do very well is to enable you, both from a career perspective and also, you know, as a marketer thinking about your clients' problems, to really understand where those challenges and opportunities are. Clearly, you know, the fourth idea would be that you need to come away feeling confident you could design integrated programs. Yeah, so at the end of the day, your value as a marketer or a PR person, whether you're on the client side or on the agency side, is can you actually pull together these kind of integrated plans? Or at least you understand how all the pieces come together. And importantly, and you heard this referenced a few times by our speakers, to do that ethically, yes? It's a very, we teach this much more broadly in our marketing and PR programs as well, that the power and importance of ethics in what we do. But, it is as important, if not more important, in healthcare. And it's one of the ways by which, we ultimately support our reputation of the organization we work for and patient health counts. And finally, I just leave you with this idea that, and it's being spoken about a lot, and it would be my one piece of counsel to you all, if you're early in your careers, is to start thinking already about how marketing and communications aligns with broader business goals. So as you travel through your career, what you'll find is a lot of business executives will say, the marketing folks don't really understand the language of business, or the marketing folks don't understand finance, or, the marketing folks are so obsessed with, shiny new objects, they're not focused on things like revenue and growth and profitability. Yes, now that's unfair, clearly, but there's some concern that as we become so specialized in our fields, that folks have lost some linkage back to the underlying business needs, and so that's one of the things you'll learn. So Julie,
I would just
advance the slide. Yep.
It's like thinking. I think with the certificate, you learn how to think strategically, but also execute strategically. I think that's an important combination, especially in healthcare. Not to say that that's not the case for other, marketing spaces. But so do you want me to take over on this, Michael? Yes.
Yes, if you could talk us through, that'd be fantastic, Margie. Sorry.
So this the certificate, like the other certificates that NYU offers, is built around taking 2 foundational courses and 2 electives. And you've heard Destry and I kind of allude to the foundational courses. That first one is understanding that evolving healthcare ecosystem, understanding all the stakeholders, how they work with each other, following the money, I think that's what Destry kind of alluded to, but understanding how that works, because, that drives a lot of the interactions and some of your clients. You will have clients, or you may be the client, you may be the hospital that's a client, or you may be the managed care company that's a client, but understanding that ecosystem is important. But it's also because it's changing. We kept talking about the Apples of the world, the Amazons, and the CVS Aetnas. I mean, that is absolutely changing. And understanding those different business models now. So, I think we kept talking about, we thought we knew the business model for CVS. It is no longer a pharmacy, right? It is much broader. It is a healthcare organization. I think the second foundational course that we felt was really important was, taking, many of you may have already been working in the marketing or PR space, but taking those skills and really demonstrating how they apply in the healthcare world. A core part of marketing communications essentials for healthcare is around understanding that patient journey. Everything in healthcare starts and ends with that patient. So a deep understanding of what the patient journey looks like and how to build one, right? So whether or not, you're working for an agency or on the client side, that's the way that you really uncover customer insights. True customer insights are barriers. And understanding, not only the patient, but then also the physician and other intermediaries and how they kind of work and help to drive some of these decisions and the emotions and the psychology around that. I mean, I think a lot about, for example, a lot of times when we look at in a therapeutic space, we say, we don't even want to talk to the OTC people who are on OTC drugs because they have mentally not even, admitted to themselves that they even need to see a physician. Those are the kind of things that are kind of unique to the healthcare space, understanding what those hurdles are, right? And then even, in certain therapeutic areas, it takes 5 to 7 years before even someone wants to even go and see a doctor about it. But understanding the psychology behind that and what you can do to kind of compress that and move that patient along. So a lot of that is in marketing communications essentials for healthcare. I think what gets interesting is with those 2 foundations, you kind of can start exploring these elective courses, right? So Yeah, one of the elective courses that we have is about more than a patient. You know, you've been hearing us talk about that, you know, patients don't even think about themselves as patients anymore. A lot of the, if you look at, you know, online and just talking to patients, they don't think of themselves as patients. They think of themselves as people with a specific condition. You know, I'm a person with Parkinson's. I'm a person with, you know, chronic pain. I'm not a patient. You know, I'm a consumer. So how do you engage this healthcare consumer more holistically is one of the elective courses. My favorite, and you know, is crisis communications. It sounds scary, but it is one of the most interesting, you know, experiences that you could have. Understanding how to communicate when your brand's in crisis and in a regulated environment. You know, nonetheless, but learning how to do that. I mean, we're seeing this right now with COVID. You know, I think, again, I think this country can do a lot more in upping their game on crisis communications and how to get people to change behavior. But this is, you know, it talks specifically about how different brands have done that and navigated and done it well, and some that have not done it well. So it's important to learn some of that. And we've been talking about, you know, the quantified self, right? So measuring the impact. As I said, data is a luxury and a curse, but understanding that. And, you know, I think the slogan for quantify self is self-knowledge through self-tracking. And it is such a fascinating space. I'm sure those of you who have your Apple watches, right, you can do your EKG, you know, do you have a pulsometer on that? You can send that, smart glucose monitors that can send your glucose ratings to your doctor. I mean, it is revolutionizing how we think about healthcare. You know, it's going to be more, next year, we won't be even talking about telehealth anymore. That's going to be the norm.
And Margie, this I think is as well as much about that as it is like, how do we know as marketers that our work is even impactful? And, you know, and this is an area I know many of you are interested in marketing analytics specifically, or feel that that's an important part. I think Margie actually kicked off that whole thread. This is the course in which you'll learn much more specifically what the tools are and the techniques for measuring the impact of marketing. And the notion of the quantified self is we now have that much more data, you know, about impacts and you know, what the impacts on people's health outcomes are. But we also have, to some extent, more data about just the effectiveness of our marketing, and that's what this course is as much focused on. So, absolutely.
We've talked about disruption and innovation, and this would go deeper into the, you know, those companies that are on the periphery right now coming in, right? So, you know, it's the Apples, the Amazons, but it's also the medical cannabis of the world. So how are they changing healthcare? And again, in conjunction with, you know, a more empowered patient that's willing to kind of, you know, take a look at these other things. And then finally, like one of the, you know, it really ladders up to one of the learning outcomes that Michael had covered is understanding how healthcare products and services really come to market, you know, from discovery, you know, and to launch, to brand building, to kind of repositioning. You know, not every brand gets launched the right way or to the right target, and understanding that whole journey from, you know, from discovery to brand building. So, you know, just, I think, you know, the way we designed these courses, you know, was from that perspective of like, if I were starting out now, you know, what would I want, you know, to learn, and what would I want to have junior people coming in having a sense of this? You know, it gives you an overview of it, deeper on the foundational, but then an overview of some of the different details in the electives.
So let's just click forward one slide and not leave people hanging. If folks on the call want to learn more, let's make this very simple. Obviously, we're here to answer questions, but recognizing you know, you may still be formulating some of your questions. Number one, I'll draw your attention at the very bottom. There's an email, sps.marketing.pr@nyu.edu. Yes, anybody who has questions about the certificate that they don't feel are answered online, and I'll show you where you can go online. You please feel free to you know, ping us on that email. And more importantly, you know, please check out the website. I'm gonna, hopefully this works. I want to show you, everyone on the call, basically where to look on the website. This little sort of graphic you'll see popping up everywhere. So hopefully that'll be a good icon or a good visual note. But on our website within NYU, let me share my screen.
Yeah, and Michael, while you're doing that, I just want to add that this is an entirely asynchronous program.
Yes.
So, you know, I think the other thing that we were thinking is let's design it for people who are already working, you know, at an agency or a company, and so that they can do it on their own time. So each course is about 7 weeks, 7 modules or 7 weeks. You can do over 7 weeks, but it's really at your own pace. And so there are recorded lessons, videos, as well as assignments. I mean, part of you know, what we pride ourselves with SPS is the applied nature of learning. So you will kind of be coached through how to create, in my class, you know, a patient journey. How does that work? What does a marketing mix look like? In Destry's class, you'll have to kind of really understand, you know, a certain ecosystem within that ecosystem. So really hands-on learning, but at your own pace. So all asynchronous.
Excellent. Yeah, no, I think that's a very good point, and thank you. Hey, Julie, if I can share my screen, great. If not, it doesn't matter. Let me see if I can try. I mean, I'm going to do nothing but share a website, but I just want you to know where that is, so you can go there. There is on NYU's broad navigation, you really want to go to a thing called professional pathways. Yes, NYU School of Professional Studies, professional pathways. If you Google that, you'll get at least to the right place. Or if you want to Google NYU SPS certificate in healthcare marketing and communications, you'll get to exactly the right place. But this is the place where it would give you details of the program, the courses we've been talking about, and it would allow you to register essentially for those courses. If you want to register for individual courses, you can, but we encourage you to declare your certificate candidacy, because what that means is we could award you the full certificate after you complete the 2 foundation and the 2 electives. We're offering the 2 foundation courses to start in the fall. We'll offer them again in the spring, but we'll offer them in the fall. If you're going to go for the certificate, you want to complete the foundation courses in the fall, or as soon as you can, before you can go on to the electives. So the electives will start up in the spring. We're trying to get as many folks as we can through the foundation courses this fall. I strongly encourage you to sign up. Courses will start at September. Correct me if I'm wrong here. I think it's September 12th. It's mid-September. I should know that, of course. Apologies, but we start soonish, and you know, things will fill up. There's a lot of people interested in the program, and as Margie said, it's entirely async online, which means you have a professor who's prepared all the material. You have a professor who's going to be interacting with your content, you know, answering your questions, etc. But you just don't have a live session. And what that means is you're able to move more at your own pace. So anyway, so this is the website, you know, check it out. Find us. There's more information. As you click on these courses, it will tell you more about the individual courses. It will allow you to register. I'm going to stop share, Julie, if you want to go back to the slides, and then I'm going to pick up some Q&A that's coming in, and we'll try and wrap in the next 5. But send us an email, guys. You know, there's still a bunch of folks on this call, which is excellent. A lot of folks seem to be interested in this topic, and please, no question is too silly or trivial. We're very happy to help. And I think Julie also smartly put a link in the chat, which hopefully everyone can see as well, which you can click on directly. So we had some questions about, and Kate, I don't know if Kate is on. If she is, great. What's the deadline to declare certificate candidacy for the fall? Let me see. I'm going to punt Kate if she's on. If not, we will get back on that question. I would imagine it's probably somewhere. Kate, are you on?
Hello, I'm here. Yes.
Good.
Hi. So there isn't really a deadline to declare candidacy. We just ask that you do it as soon as possible so that you can start getting the benefits of being a part of the certificate program.
Okay. And then secondly, what's the pricing of the certificate?
So each course is, so you pay for each course as you take them. So you wouldn't need to pay for all courses at the same time, which is really nice because it helps with, it just helps, it makes it easier and it gives you more flexibility. And then each course is, I believe it's $1,440 per course.
Right. And we've priced it to, it's a very packed course, a large number of contact hours, and we've priced it very competitively to other programs, you know, given the level of depth that you have to go into in our course. And I think you would probably estimate somewhere around, you know, between 6 and 10 hours, maybe around 6, 7 hours a week. 4 to 6.
4 to 6.
Yeah. So depending on the course, to be honest, and frankly, how far you want to go into the details. You know, Margie, who's teaching this floor, saying 4 to 6. That's good to know. If the instructor says 4 to 6,
Don't scare them.
then you know that's what we expect students to dedicate to the program, which we believe is very manageable. We had in mind working professionals in the course as well. So. Any other, let me see if there's any other questions from the Q&A. No, so, you know, I don't want to drag this out. We're very excited about the program. We're certainly
we have one more question. We have one more question.
I see it. Delighted to know that, you know, you all have stayed on and are as engaged as we are in this content. There have been a couple of questions along the way from our current students. So, you know, any current student in our master's program or our, you know, in PR or master's program in marketing is, of course, welcome to take the certificate course. It's an additional qualification that you would receive. It's not a formal part of your degree at this point, but you know, you are welcome any NYU student. I think there are discounts for NYU students. There are discounts for alumni of NYU, etc. So, you know, encourage you to think about that as an alternative. If you're starting your MS this fall, you know, I think you should look at your workload and evaluate if you think you can start the foundation courses in this fall, or perhaps you might want to see what the workload's like and then start foundation courses in the spring. But you could certainly do the two in parallel, which would be a very smart way to graduate with not only a, you know, well-recognized degree in marketing and PR or PR, but also this extra certification.
Or, you know, I don't know, I mean, this is maybe too far ahead. Like, you know, if during the summer, if you're an MS student, your first year, maybe during your summer, this might be great to do while you're also doing your internship, because, you know, kind of keeps you, I think you can leverage the first year curriculum from MS. Like, I teach campaign strategy for the MS integrated marketing. I think having that is great. It's not duplicative. I think having that will actually make it a little bit easier for you when you do take the healthcare courses. So not to compete, but to build on.
Cool. I'm going to pause 1 second to see if we got any other questions, but we're right at 3:30, and you guys have been phenomenal, stayed with us for the last hour and a half. I hope, like me, you found the time valuable. Please let others know about what we're doing here. We will both send around a link to this video, so you'll have the full hour and a half, and we'll also post a link to it ultimately on our LinkedIn and our various websites. So for those who don't know, and maybe Julie, you want to pop in the chat, our YouTube address, we actually have fairly significant number of videos and discussions and talks now building up on our YouTube channel, which I encourage you also to check out. Many of them actually about careers in marketing and communications very specifically, and all of them relevant to issues related to marketing and communications, including, you know, the impact of COVID on us all as leaders and practitioners. So, you know, a bunch of interesting content there as well. I see Destry pop back in. I don't know if he came in for some final comments, but I think we're going to close, Destry. And I want to thank you again, Destry, for participating, and Margie particularly. It's been a wonderful hour and a half, and I'm delighted you were able to share with our students and others interested in the programming. So with that, I'm going to head out and close off the call, but thank you all for attending and participating.
Thanks, everyone.
Thank you.